Although smoking rates have gone down over the past decade, tobacco remains a key national public health issue. According to the FDA, nearly 1 out of every 5 U.S. adults reports using tobacco products, as does 1 of every 10 high school students, according to the CDC. And here to talk to us about the current state of tobacco use in the United States and give us some resources to help Americans quit is Dr. David Fairchild, Senior Vice President and Chief Medical Officer of Retail Health at CVS. Good morning, Dr. Fairchild. Thanks for being here.
Hi, thanks for having me on.
So the beginning of April marks efforts to reduce tobacco product use. And around 10 years ago, I just found out CVS Pharmacy made that bold move to become the first and only national retailer to stop selling tobacco products in its stores. What have been the effects of that move by CVS?
Well, within the first year of our decision to stop selling tobacco products, there were 100 million fewer cigarette packs sold in the United States. And we're really proud of the efforts we started back in 2014. And more than a decade later now, CVS Pharmacy is still the only national retailer that does not sell tobacco. And we've never sold vapes, e-cigarettes, or nicotine pouches in any of our retail locations. And we continue to be a leader in supporting Americans during every step of their quitting journey, because we all know there's still work to do. And we recently conducted a survey to understand the current smoking landscape in America. And we found that 77% of US Gen Z and young adults age 18 to 28 said they currently use e-cigarettes and vapes, and nearly half report using cigarettes.
Wow, CVS definitely on the right side of that, about vaping on that position for sure. And that's startling information to hear. What are the challenges to quitting and resources available to support those who want to quit, Doctor?
Well, it's important to remember that smoking remains the #1 cause of preventable disease and death in the United States still. And according to our survey, 67% of US Gen Z and young adults say the biggest challenges teens face when trying to quit using nicotine are things like stress, anxiety, or mental health struggles. And half said they don't know where to access support programs. But interestingly, counseling and medication can more than double a tobacco user's chance of successfully quitting. And at Minute Clinic, we offer smoking and vaping cessation programs that are catered to individuals' needs. And these programs are available both in person and virtually. And in addition, smoking cessation products such as gum and lozenges designed to help curb nicotine cravings are available in CVS pharmacy stores and online at cvs.com.
Any other ways CVS Health is continuing its mission to create a tobacco-free generation?
Well, the decision we made in 2014 truly had a powerful public health impact by disrupting access to cigarettes and helping more of our customers be healthier. And in fact, in our survey, 70% of US Gen Z and young adults ages 18 to 28 believe that having fewer retailers selling nicotine products makes a difference in reducing teen use. And that's why our efforts are so important. But there is still more work to be done. We're always looking for new ways we can help. So I'm excited that CVS Health Foundation is working with leading organizations that support educating the public on the dangers of tobacco products.
Very good.
Yeah.
Yes, and Doctor, we'd like to let our viewers know they can visit cvshealth.com/tobacco for more information. I know CVS is committed to continuing to support Americans during every step of their quitting journey. And it's been such a pleasure talking with you, Dr. Fairchild. Great information. We appreciate it.
Thanks for having me on.